The information shared on Light Body Radio is for educational and informational purposes only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician, licensed healthcare provider, or qualified wellness practitioner with any questions you may have regarding a medical condition or health goal. Dr. Lara May, her guests, and affiliates do not claim to cure, prevent, or treat any condition and are not responsible for any actions taken based on the information shared in this podcast. By listening to this podcast, you acknowledge that you are responsible for your own health decisions and that any actions you take based on the content are at your own discretion and risk. Thank you for tuning in to Light Body Radio.
Welcome to Light Body Radio, where science meets soul and healing gets multidimensional. I am your host, Dr. Lara May, functional medicine pharmacist, master intuitive Reiki channel, and certified life and health coach. Here we decode root causes, transmute stuck energy, and empower your full spectrum healing journey, body, mind, and light body. This isn't just wellness, it's awakening, grounded in science, guided by spirit, and designed for your evolution. Let's rise and radiate. Welcome to the next level of you. Dr. Bryan has been involved in nitric oxide research for the past 25 years and has made many seminal discoveries in the field. He is a successful entrepreneur and founder, chairman, and CEO of Bryan Therapeutics, a privately held clinical stage biotech company that is actively engaging in the discovery and development of nitric oxide-based therapies. BTI has active drug development programs in heart disease, Alzheimer's, and topical drugs for diabetic ulcers and non-healing wounds. And Dr. Bryan is also involved in the consumer line of products that are some of the most successful nitric oxide products on the market. Welcome, welcome.
Hi, Laura. Thanks for having me. Good to see you.
Good to see you. So tell us a little bit about your journey and how you became passionate about this specific area, because it is very niche.
It is. And it has been a journey, I can tell you that. No, I got introduced to this whole field of nitric oxide back in the late 90s. You know, I had a bachelor's degree in biochemistry from the University of Texas, trying to look for my next kind of evolution of that growth in higher education. I was a student at LSU School of Medicine, and I was introduced to this new science of nitric oxide. In 1998, a Nobel Prize had been awarded for the discovery of nitric oxide as a signaling molecule. And I was training under a pharmacologist at LSU, working on a PhD in molecular and cellular physiology. And we just, it caught my attention, and it was just signaling molecule. It's a gas. It's gone in less than a second. And obviously there was a lot known about it because the Nobel Prize had just been awarded, but there was so much that we didn't know about it. And, one of the guys who won the Nobel Prize, Dr. Ignaro, told me at a meeting one time, he goes, Nathan, I think if we can figure out how to make nitric oxide or restore the production of nitric oxide, it'll change the world. Because at that time, 25 years ago, we had a clear understanding that loss of nitric oxide was really the earliest event in the onset and progression of chronic disease. So if we can understand what leads to a loss of nitric oxide, correct that, or develop safe and effective therapies or product technology to restore nitric oxide or give nitric oxide. So that was where it all started. And then, I finished my PhD in about 2.5 years. Then I trained at Boston University Medical Center. And then I started my own independent research career as a professor of molecular medicine at the University of Texas Health Science Center in Houston. And so here we are. Then made a lot of discoveries, filed a lot of patents, several dozen issued patents now. And I stepped away and retired from academia, I guess almost 10 years ago. So I went from straight basic science to academia to entrepreneur. So here we are today.
Well, so let's start with what is nitric oxide for our audience, because I'm sure they've heard of maybe Cialis or Viagra, because that's sort of, I think in the mainstream up until just recently, that's if people had heard of it at all, that's maybe how they heard of it. But let's actually break it down into what is its function in the body and why do we care? Honestly, you know, like why
That's
should
right.
our audience, you know, like be interested?
Well, let's address the Viagra story, because, you know, that drug was approved in 1998, the same year the Nobel Prize was awarded. And there is a misconception, even by physicians who prescribe it, that the drugs like Viagra and Cialis and Levitra, those are nitric oxide active drugs, and they're not. So they work downstream of nitric oxide. In fact, for those drugs to work, the patient has to be able to produce nitric oxide. And we know that 50% of the patients that have been prescribed these PD-5 inhibitors for the past 27 years now don't respond. And mechanistically, we know that they don't respond because their body's not making enough nitric oxide to lead to that second messenger that these drugs are working on. So that's number one. PD-5 inhibitors of Viagra do not affect nitric oxide production. They potentiate nitric oxide signaling, but they do not work at the production level. So very important concept there.
That is, yes.
But nitric oxide is a gas. It's naturally produced in the body. It was first discovered to be produced in our endothelial cells, the cells that line all the blood vessels throughout the body. But it activates and signals the smooth muscle around the blood vessels to relax, and that leads to dilation, vascular dilation. So now we can improve circulation, oxygen delivery, and improve blood flow. So that was how it was first discovered, but it's also produced by our immune cells as part of our innate immune system to kill bacteria, viruses, any pathogens. It's a neurotransmitter in the central nervous system that's involved in long-term memory potentiation, cognition, neurotransmission. But it's extremely important signaling molecule. And when you lose the ability to produce it, you know, as I said, you start to get erectile dysfunction, you get high blood pressure, you develop metabolic disease, you develop exercise intolerance, and then, you know, dementia, and eventually Alzheimer's. But that was the story, you know, 25 years ago. Today, we know that nitric oxide is much more than a vasodilator. It's the molecule that tells our own stem cells to mobilize and differentiate. So you have more stem cells in circulation, so you recover better, you repair and replace dysfunctional cells. It activates the mitochondria in every cell. So you generate more energy more efficiently, even with less oxygen. And then it induces mitochondrial biogenesis. And then thirdly, it activates telomerase, the enzyme that prevents our telomeres from getting shorter. So now we know that, you know, shorter telomeres, shorter lifespan. If we can prevent telomere shortening, we can live a longer, healthier life. So nitric oxide is the kind of unified molecule in anti-aging, in biohacking, in human optimization. So it's a foundational molecule.
Beautiful. Yeah. So, I mean, definitely very impactful. A lot of, you know, implications there. Why and how does our body stop reproducing it? Is it part of, I hate to use this phrase, but the natural process of aging, which I say I hate that because I feel like it conditions us to accept things that might not necessarily be, you know, we're told that they're predetermined, but that's not necessarily true.
You're exactly right. Now, look, if you look at the clinical studies and the clinical data, you can see that there is this age-related decline in nitric oxide production, about 10 to 12% loss per year. So on average, by the time we're 40 or 50 years old, we have, you know, 50% of the capacity to produce nitric oxide we did when we were, you know, in our teens or early 20s. But now we understand the mechanism of production that we can prevent this age-related decline. So it's not part of the natural process. In fact, it's unnatural, but everything we do in America, the standard American diet, the lifestyle, is not natural. And that's what leads to the onset and progression of chronic disease. So now we know we can prevent this age-related decline in nitric oxide production by simple things, you know, changing our diet, eating less sugar, intermittent fasting, caloric restriction, a balanced diet in moderation, a lot of good high-quality protein, good fats, less carbs, less carbohydrates. And so now we know that, you know, even though our chronological age, we really can't do anything about because we all have a birth date, but we can certainly, you know, affect our biological age. And I'm 51 chronologically, but I've got the biological age. Just this past week at a fitness expo in Anaheim, I've got the, you know, the biological age of a 32-year-old. So almost 20 years we've reversed this because understanding these mechanisms that lead to a loss of nitric oxide production and then doing something about it. And so that's why I think this conversation is so important, because people need to understand this and not just accept, oh, this is just natural consequences of aging. No, there's nothing natural about the loss of nitric oxide production. We know how it's produced. We know what leads to its loss, and we know how to fix it.
So it sounds like, leading a generally anti-inflammatory lifestyle as much as possible, but are there specific things on the natural side of things that we can do to help ourselves? And then I want to talk about the exogenous things, the supplement side of things too. So.
Well, once we figured out how the human body makes nitric oxide and understanding those production pathways, then we start to interrogate, okay, what's disrupting each of these pathways?
Mm-hmm.
So I talked about there's an enzyme in the lining of the blood vessel that makes nitric oxide, but we also discovered, we and others, 20, 30 years ago, that there's bacteria that live in our mouth on the dorsal part of our tongue that are responsible for producing nitric oxide that's vasoactive, that's regulating systemic blood pressure. So then we know that things like fluoride, fluoride in toothpaste, fluoride in drinking water, and fluoride is put in toothpaste and drinking water because it's a known antiseptic, right? It kills bacteria. And so when we consume fluorinated water or use fluoride toothpaste, it's completely eradicating and destroying the oral microbiome. And it leads to an increase in blood pressure because it's decreasing nitric oxide production. So that's number one. 73% of municipalities in the U.S. have fluoride in their drinking water. I think we're moving in the right direction because fluoride is a toxin. It lowers IQ in kids by as much as 7 points. It shuts down your thyroid function, and it's an antiseptic. Right. Number two is mouthwash. Anything that says antiseptic. 2 out of 3 Americans wake up every day and use mouthwash, and 2 out of 3 Americans have an unsafe elevation in blood pressure. And we published in 2019 that it's not an association; it's actually causation.
That's powerful.
You see the commercials. This mouthwash kills 99.99% of the bacteria in your mouth, and that's not a good thing, by the way.
Right? Exactly. I mean, it's marketed like it's great, but
these companies advertise this. And it's causing systemic disease. We published if you use mouthwash within 7 days, in some cases, we saw a 26 millimeter increase in blood pressure by strictly just destroying the oral microbiome. So if you're using mouthwash, you have to stop. Get rid of fluorides, a non-fluorinated toothpaste. And then thirdly are the antacids, specifically these proton pump inhibitors. The Prilosec, the Prevacid, the Nexium, the omeprazole, those drugs, and you don't even have to have a prescription for these drugs anymore. You can go get them over the counter. And these drugs were never tested by the FDA for long-term use.
Right.
Now that we have patients using these for many years, here's what we know. People who have been on these for 3 to 5 years have a 40% higher incidence of heart attack, stroke, and Alzheimer's. It's not an increased risk. It's an increased incidence of heart attack, stroke, Alzheimer's. And we know because they're completely shutting down nitric oxide production from both pathways, from this enterosalivary circuit, and it's leading to an inhibitor of the nitric oxide synthase enzyme. So these are very dangerous drugs, and if you're on an antacid, you have to stop. If you read the package insert of an antacid, no one in their right mind would take these drugs because they're so dangerous. They provide no benefit, and it's all risk.
Yeah, I mean, I still work in critical care. And so even in the hospital environment, there's a huge push to be much more judicious with how we use the PPIs for, the stress ulcer prophylaxis.
That's important. I'm glad to see that conversation because used to, when I was in academia, if anybody was admitted to the hospital for whatever, for influenza-like illness, for trauma, or whatever, that was just omeprazole or pantoprazole was just part of the normal regimen. Everybody got it, regardless of if they had GERD or what. And I'm going, what in the hell is going on here? How is this care?
Yeah. And that happens a lot still. And so from the role of the pharmacist, so much of what we do is with stewardship of various things. And so that's becoming an actual, a real top priority. Again, because of the trickle down effects, it's not benign. I think a lot of, consumers and physicians alike think, well, if the side effect profile is fairly benign, meaning it doesn't produce anything that is right in my face that's obviously harming the patient, then it must be fine and it's no big deal. And, but the reality is that there's a huge amount of downstream effects. Again, like because especially with these drugs specifically, when we're altering the pH of our stomach, then now we're not digesting food appropriately. I mean, and ironically enough, the whole reason you started taking this is because you were having heartburn, which is an indication of maldigestion and malabsorption. So
yeah, for me, it never made sense. As a biochemist, I go, yeah, as you said, your heartburn and reflux is because your body's not able to digest those proteins, and your body's trying to get rid of it. It's a foreign antigen to the body, because we're never intended to incorporate plant or animal proteins, right? We got to break it down into amino acids, then make human proteins, and the only way that happens is if you have sufficient stomach acid production.
Yes, absolutely. So, but I actually do have a question. Then, do the H2 blockers, the things like famotidine, or what people would recognize as Pepcid by brand name, do those also have the same repercussions, or not?
They're not as kind of dangerous to the risk profile specifically as the PPIs. But the H2 blockers are still inhibiting stomach acid production.
Right.
So what I recommend is, we should never inhibit natural processes. And unfortunately, most drugs are synthetic compounds that inhibit biochemical reactions, because the body always responds to what you give it. But here's what I'm not opposed to. Like a bicarbonate, a buffer that can kind of buffer maybe hypersecretion of acid. But you shouldn't, because then your body's going to respond. And it's a natural buffer. But completely inhibiting, with H2 blockers or proton pump inhibitors, I don't think it's a good idea. But there's not enough data on the H2 blockers specifically, as there has been on the proton pump inhibitors, to show that increased risk in Alzheimer's, heart attacks, and strokes. But I still don't think it's a good idea.
Yeah, I agree with you. I think that there can be a lot inferred by just their mechanism. Again, if we think about it logically from their mechanism of action. And, and then what we have studied in the other drugs that we know now that you said with these studies, we do have actual causation and not just the implication of the possibility. And
Right.
so, and it's one of those things too, where, and unfortunately in the field that we're in, if a drug is a certain age and, and the H2 blockers are super old, and so it's just not profitable to do the research. And so it's just not going to get done unless someone, really takes a very, again, niche interest and sort of goes on their own to do it. But anyway, so are there, I love this topic of conversation in terms of, making it real for our listeners in terms of what is out there and what is having these impacts. So fluoride, PPIs or H2 blockers. Anything else maybe over the counter that we wouldn't normally think about?
The mouthwashes, obviously, then overusing antibiotics, which obviously destroy the microbiome, not just the gut microbiome, but the oral microbiome. And then, there's data coming out now that, getting your cholesterol below 200 is disrupting intracellular signaling. There's an increased incidence of insulin resistance and diabetes. So, again, it's always risk benefit and using the best medical judgment on what's best for that individual patient. But I don't think it's a good idea to get our cholesterol below 200 because, we interrupt intracellular signaling. We can't make testosterone or estrogen, and we can't make vitamin D because all of those hormones are built on a cholesterol backbone.
Right.
But those are the big ones in terms of pharmacotherapy and lifestyle. And then, the other is, eating sugar and simple carbohydrates. Anything that leads to an increase in blood sugar disrupts nitric oxide production. Everybody's different in terms of their metabolic flexibility. Some people can eat high glycemic index foods and kind of dampen that glucose tolerance and not lead to hyperinsulinemia. And others, you eat something, blood sugar stays up for a while, insulin goes up, and that starts the whole inflammatory cascade. So for me, sugar's the enemy, sugar's the toxin, sugar's the poison. And now that, these continuous glucose monitors are readily available, people need to understand what their response is to their diet. And because, glucose is sticky. It's a glue, as the name implies, and it sticks to proteins and, enzymes and causes a lot of dysfunction.
Yeah. And I think, again, I'm happy to go back to the statin conversation too, because they are way overprescribed. And again, for some reason, there's this mantra in allopathic medicine of, oh, they're so benign. And you get so much benefit out of them for, for such little risk. And it's just not true. They increase your risk for diabetes. They increase your risk for developing, dementia, Alzheimer's. Yeah. And we know that. And I feel like, no, I don't really feel like patients are actually told that when they're put on them. Like I see my patients come in through the ER, and now I'm seeing, especially post COVID, so many younger people in their 30s and 40s with, cardiac events or neurological events, whether it's TIAs or strokes. And that's part of the algorithm and part of the guidelines. They automatically get put on the statin regardless of their cholesterol. Yeah. And so then if you have a healthy cholesterol and you're put on these drugs, it drops even lower. And then, like you said, we have cholesterol in our body for a physiological reason that's good.
The reason our body makes it, right?
Yeah. So anyway, I'll let you take the floor on this too. But yeah, it's one of my, sort of biggest pet peeves. And it's one of those things that I actually do have conversations with practitioners when I'm in the ICU or interacting with, my hospitalist physicians, is let's be discerning here. I know this is what the guidelines say, but, let's really see, does this patient need it? Will it truly benefit them? Or are these patients that are younger, is it worth it, for the long-term downstream possibilities for them?
No, I think, look, the data are very clear to me. Somebody who reads the scientific literature and understands absolute risk versus relative risk. And if you look at primary prevention, secondary prevention, there is no clinical benefit in prevention with statins, getting your cholesterol lower. So the preponderance of evidence shows no benefit in the general population. Sure, there's certain kind of what we call pleiotropic effects of statins that, I don't think are quite understood. But okay, so maybe a little benefit, but in the general population, no benefit in terms of prevention, even secondary prevention trials. What's the risk? Oh, well, low vitamin D, immunocompromised, diabetes, Alzheimer's. And when you look at that quotient, there's no one in their right mind whose objective would say this person would benefit from a cholesterol lowering medication. But yet, as you said, it's guidelines, and you have to, most cases stick to the guidelines. But, there has to be a reevaluation of that data, and the guidelines have to change because first, do no harm. If you're giving these drugs that don't provide any benefit and they're leading to long-term harm, you have to stop. I mean, it's not even a discussion because the data are there. It's the misinformation, miscommunication of data and showing and reporting things as relative risk and not understanding the number of patients you need to treat to see one benefit. I mean, to me, that's the metric. And the number to treat for cholesterol lowering medication to see one benefit is tens of thousands. But what's going to happen to the other tens of thousands that are treated? Well, they're going to get Alzheimer's. They're going to get low vitamin D. They're going to develop hormone disorders. They're going to develop low testosterone, immunocompromised, and prone to infections, insulin resistance.
Exactly. Yeah. Just the insulin resistance and diabetes alone, for again what we already know happens when you have long-term uncontrolled glucose, and it develops into diabetes, and then it develops into advanced disease. I mean, yeah. Anyway.
Yeah. So cholesterol doesn't cause heart disease. So why in the hell are you treating it?
Right.
Pretty clear. Why treat
Great
something?
Question.
Yeah.
Great question. So in terms of then, this is another question I have, because now we know in terms of hormone replacement treatment that actually, if you start it earlier for both men and women, it can remind your body to keep producing instead of waiting until, for a woman, if she's already gone through menopause and then you do HRT, not quite as effective. And then for, men obviously don't go through that same process, but they do unfortunately have a lower testosterone production over time. And so is this sort of the same, if we exogenously supplement in some way, shape, or form with a nitric oxide product, will it help our body sort of remember to keep doing what it's supposed to? Or does it have that feedback where it stops because some people have been told, well, if you supplement, then your body will stop doing the thing it's supposed to do naturally. So then they don't want to. So can you clear that up for us?
No, of course. Look, and it's a very important question. And before we ever started developing product technology, we had to address that question, because what we're trying to do is, number one, change the conversation of medicine from being reactive to being proactive, right? Medicine and medical practice is fear-based, right? You only go to the doctor if you get sick or something bad happens. Mm-hmm. I think we need to change that and start people to listen to their body. If they start to develop symptoms, your body's always talking to you. You just have to listen and make changes. So we understand how the human body makes nitric oxide. We know what leads to a loss of its production. And I know how to make nitric oxide exogenously. So I make a solid dose form of nitric oxide gas that's in the form of an orally disintegrating tablet. But the first thing we did before we ever did this was we give the lozenge and just make sure it's not inhibiting the natural production of nitric oxide in the lining of the blood vessels, or the ability to mobilize an immune response and upregulate the INOS if we get an infection. And then two, is it affecting the oral microbiome? And so what we're finding from my technology is that we actually see a 20% improvement in endothelial function within 20 minutes of taking the lozenge. And we're completely restoring the normal flora, killing the pathogens, restoring the non-pathogenic commensal bacteria. So what I've developed is, if your body has lost the ability to make nitric oxide, then we do it for you, but we're improving your body's ability to naturally make it. So there is no feedback inhibition. There is no shutting down or inhibiting endogenous production. We're working synergistically. And I think the only way we can do that is understand the biochemistry, the physiology, and the enzymology, that if you understand the entire system, then if something breaks, you know how to fix it, right? Mm-hmm. If you're a mechanic mm-hmm. and you don't know how the system works, or an engineer, then you can't fix it. And unfortunately, most companies out there who are selling nitric oxide products have no idea about the underlying biochemistry and enzymology, or even the microbiome. They're just out there selling products, putting nitric oxide on the label and hoping, the customers buy it. But it's fraudulent and it's deceptive.
Yeah. And so I think that's really important I always preach this to my audience and to my clients, is be very discerning and picky about where you're sourcing your supplements from. Like, they're not all created equal. And again, we know this, and unfortunately, and ironically, or maybe it's not, maybe it's intentional, when a huge pharma company buys a supplement company, usually the quality goes down, and what's in that product is not what it says on the label. So it's worth it to pay a little extra for something that has been independently tested and made in the U.S.
No,
that's
for
usually
sure
what I tell my clients.
Now, look, I test all the products. Every nitric oxide product that comes to market, I've tested hundreds, maybe thousands. Now, because we have instruments that can tell us if it produces nitric oxide, if it stimulates endogenous nitric oxide production and do what it's intended. And 99% of the products out there do not move the needle on nitric oxide. And, the company's spending the most money on advertising, because I don't watch a lot of TV, but when I turn it on, I'm seeing these companies out there advertising and spending probably millions of dollars in adverts. But I test these products and there's no nitric oxide at all. So just because a company's if they're having to spend more money on marketing, they're probably really good at marketing, but really poor at science. And to me, and the reason I do this is because those companies could kill an entire industry, right? And I see this, I've witnessed this for the past 10, 15 years, because I go out and I give lectures, 30, 40 lectures a year all around the world. And people in the audience, physicians, patients, consumers will come in and they go, Nathan, what you said is very convincing, but I bought this nitric oxide product that's advertised on TV. I took it. It didn't normalize my blood pressure. I didn't feel any different. In fact, I went to the dentist and my oral cavities, or my oral health is even worse. And they go, so nitric oxide doesn't work for me. And I go, what? That's the most dangerous interpretation you could ever take.
Right. And it's actually impossible.
Nitric oxide always works for you if your body can make it.
Right.
What doesn't work for you is that product. What doesn't work for you is that company who sold you a bill of goods without any science behind it. And so when that happens, we have to hold these companies accountable, these products accountable, because if they don't understand the science, how can they create a product to address the underlying deficiencies of what goes wrong in people that can't make it. And there's no company out there that does that. You know, I'm the founder, chairman, and CEO, a former scientist who leads our company, who leads our product development. All these other CEOs from, you know, there's insurance people out there selling nitric oxide products. There's tech executives out there selling nitric oxide.
You're talking about, yeah.
And it's any consumer thing that this company knows anything about nitric oxide to even think about developing a product. When this science is so complex, and big pharmaceutical companies been working on nitric oxide drugs for 30 years. I've consulted with many of them, and even they haven't been able to develop a nitric oxide technology. But yet a former insurance salesman or human biologist or tech executives suddenly know how to make nitric oxide. Give me a break.
Yeah. So where can people find your product? What is it called? And then we haven't talked about your book yet, so I definitely want to, So tell us all the things.
Yeah, so no, we're doing two things. Number one, our parent company is called Bryan Therapeutics, and we've got consumer products we've had on the market for a number of years, but because we've cracked the code on making safe and effective nitric oxide product technology, we're developing drug therapy. So we're going through the FDA to develop indicate drugs for heart disease, Alzheimer's, topical drugs. So that's in the works through Bryan Therapeutics. And then the parent company has acquired my consumer products division, but that brand is called N101. So all of our consumer products got dietary supplements. I just created a nitric oxide biome-friendly toothpaste that's incredible, fluoride-free. We make a skincare line of products for skincare and beauty. We make a fermented beet powder for pre-workout for energy. But those products can be found at n101.com. That's the letter N, number one, the letter O, number one.com. And then, but I'm more interested in education and awareness. And so I've created a YouTube channel where I provide information to hopefully inform and educate consumers so they're not duped by these commercials on TV and radio and buying nitric oxide products that don't work for them. They can't work for them. And so my YouTube channel is Dr. Nathan S. Bryan Nitric Oxide.
Okay, perfect. Yeah, and that's the whole reason I do this show too, to get the information out there, at least get people thinking critically and asking questions for themselves and thinking on their own and questioning what am I told? So even if you question what you hear on this show, then I feel like we've served our purpose.
Yeah, you have to, trust can be a good thing, but it can also be a very dangerous thing.
Yeah, exactly. Well, anything else that you want to bring light or attention to that we haven't touched on before we wrap up?
No, I mean, look, I'll shamelessly plug my latest book I launched in March of this year. It's called The Secret of Nitric Oxide, Bringing the Science to Life. And in this book, and, I'm thankful for Brick Tower Press, who's my publisher, and my agent, Alan Morrell, and creative management partners who really encouraged me and was supportive of this project. But I know it's an important read because it tells the story of nitric oxide, what it is, what it does, what led to a Nobel Prize, and why everybody on the planet should be concerned about their own nitric oxide. But I think interdispersed in this book is my own personal journey of, where it started, these discoveries that we made that changed the way we thought about nitric oxide, and then what allowed us to develop product technology that's unlike any other products or companies out there. So, I encourage you to read it. You can get it at nathansbook.com or anywhere books are sold, Amazon, Barnes & Noble. But, it's a must read, not because I obviously have a strong personal bias, but it's just, it was a 3-year project, and reviewing the literature, figuring out where we were, where we came from, but more importantly, where are we going?
Mm-hmm. Absolutely. So if you're listening to this while driving or, doing something that you can't take notes, it's all right. All of this will live on the show notes page, which is drlaramay.com/podcast. And just look for Dr. Nathan Bryan's name and picture on there. And so we'll have all of this linked there. So if you want to check out his products, if you want to check out his book, and I definitely encourage you to look into it. I actually do have one more question that just came to me. Is there a certain age that people should start thinking about this, or is it more based on maybe if they're starting to see some decline or certain chronic issues come up, or both?
Yeah. Well, I say there's only 2 people in the world who need nitric oxide. Obviously, it's the people who are sick and want to get well, and it's the people who are well and don't want to get sick. But, a personal experience, my own kids have used it in their teenage years because they're athletes, football, basketball, golf. They're smart kids. It's not just about athletic performance, it's about cognitive performance. But, they take the lozenge, they take the beet powder. The only qualifier would be, one lozenge would be one whole lozenge to be for a 50-pound or 100-pound person. So if you got a 50-pound kid, just cut the lozenge in half. We're not concerned about issues, but just to, err on the side of caution. And then a 25-pound, kid or toddler, could take a quarter of a lozenge. But extremely safe. We're delivering the amount of nitric oxide that's naturally produced to recapitulate natural production and signaling.
And if people are on antihypertensive meds or blood pressure medication, is that something they should also be cognizant of in terms of taking this with that?
Well, we've treated thousands of patients in clinical trials, FDA-approved clinical trials, and even in consumer clinical trials, and we've never seen an interaction with current meds. We've never seen a safety signal. In COVID, we had a drug in phase 3 clinical trials, and some patients were on 18, 20 different prescription medications, including antihypertensives. And there was no interaction, no safety signal, even at a much higher dose we were delivering as drug therapy.
Okay, good.
No, I think it's a very important consideration, because what we're finding is if you take nitric oxide or our products or improve your natural production, your blood pressure will naturally come down. Mm-hmm. And then you can start to have a conversation of, do I really need these antihypertensive medications if I'm dilating blood vessels, normal vasoreactivity, and blood pressure normalized? And now we can start to hopefully wean patients off. But that's a conversation between the pharmacist and the physician, but I think it's one that can be had finally.
Right. I mean, and that's one of the big things that we as functional medicine pharmacists do is we work with our clients to, streamline the diet, the lifestyle, get, the inflammation burden down to, as low as possible. And we track. And so what I do is I have my clients keep track of things, whether it's their blood pressure, their blood sugar, whatever it is that is they're looking to correct and to heal. And so then when they do go to their practitioner, they have the hard numbers and say, look, this is how I have improved. Can we now de-prescribe? Can we get, but again, yes, it's always a conversation between patient and physician and pharmacist and physician for sure. So again,
that is so refreshing to hear that that's actually going on. So we need more people like you.
Yes. Well, and I am actually a leader within an organization too. So we're teaching more pharmacists about this every day. So yes, it's happening.
That's good.
So again, well, thank you. We sort of digress, but we'll wrap it up now. Again, thank you, Dr. Bryan. I really appreciate your time and all the work you're doing in the world. And so keep us posted on new developments, and we can have you back on, or add things to the show notes too as they develop. So thank you so much.
Okay, thank you.
All right, everybody. We will catch you in the next episode. Definitely check out nathansbook.com or head over to the show notes page at drlaramay.com/podcast. Thank you for joining me on Light Body Radio, where functional medicine meets intuitive healing and transformation happens on every level. If this episode resonated with you, please like, share, and if you're ready to go deeper, visit drlaramay.com to book a functional medicine consultation or an intuitive healing session. Whether you need to rebalance your body, clear your energetic blocks, or reconnect with your soul's purpose, I've got you. You can also follow me on Instagram or TikTok at Dr. Lara May for daily inspiration, energy updates, and healing tools. Remember, your healing is multidimensional, and so are you. Until next time, honor your body, trust your intuition, and activate your light.